called Chigilsa Adhikrita Purusha, he is also called Adhisthana Purusha, he is also called Shaddhadu Purusha. Who is that Chigilsa Adhikrita Purusha? Who is that Adhisthana Purusha? He is nothing other than the patient. If the patient is unable to prepare kashaya as he cannot afford while going for job and time is not enough, that the patient is telling to me in the morning to prepare. He is not married. Okay, he is not able to prepare kashaya. That's the problem. So I can adjust. I want to adjust. Chigilsa Adhikrita Purusha. We are doing all the Chigilsa on that patient, which is called Chigilsa Adhikrita Purusha. Puram Sharire Navasyedi Iti Purusha. Okay, clear. OP, IP treatment, Chigilsa, Agnikarma, Kshaраkarma, internal, external, everything is going on that patient. Hence called Chigilsa Adhikrita Purusha. Adhisthana Purusha. That patient is Adhisthana for all the treatment procedures. Hence called Adhisthana Purusha. Clear or not? He is also called Shaddhadu Purusha. Why? Why? Shaddhadu means he is having a body and also his soul inside. That body is made of Panchamahabhuta, whatever it is, but he is having a soul. Okay, all the he is called Karma Purusha. All the Panchakarma, Shodhana, Snehana, Svedana, Shastrakarma, Agnikarma, everything is doing on that patient. Karma Purusha is nothing other than patient. And you are knowing that, okay, man plus Indriya. Prayatna, Sukha, he is having Sukha, he is having Dukkha, he is having his own Ichcha, Dvesha, he is having his own things. Okay, so we want to check the physical status, body weight stature, the mental status, the psychological state, the social status, the position, the family status, single, married, widowed. Okay, the economic status, the emotional status, the job status, and the place of living of the patient whenever we are giving a medicine in Ayurveda. That is mentioned behind Karma Purusha. Clear? Clear or not? I think you are knowing, but a little bit from my own sides. Sir, we can do for one, no need to rush the session. Okay, okay. I will tell. Clear or not? This point. Clear or not? I'm just giving this answer for this. And okay, everything, everyone, we are studying Karma Purusha, but this is the thing. That's the thing. Okay. We want to check each and every aspect of the patient before. That's why we are giving Guluchadi Kashaya for one patient, and we are not giving that Kashaya, Dusra Kashaya, or not, we are not giving Kashaya to the another patient. But because he is telling my wife is not able to prepare, he is telling, why you are giving me this Kashaya to prepare? What we will do? Clear or not? Knowing the patient, Karma Purusha concept of personalized medicine in Ayurveda. Clear? You are having any doubts, you can ask. Whether it is okay, boring, or you are okay with the class. You are knowing these points, yes or no. Why I'm keeping these questions is that it is a single kabaja, it is going on. Yeah, obedient patient is also mentioned in Chikilsa Chatushpada. That patient is obedient, but he is giving one excuse that, sir, I am not able to prepare the kashaya. Also, you are also giving excuse to your doctors, isn't it or not? Sir, can you give kashaya tablet to me rather than writing kashaya chuna? I am able to prepare kashaya. Isn't it or not? Yes. If we are doing, the patient is having the same right. Patient is a karma purusha. Why? Because everything is, Ayurveda is revolving around that karma purusha. Clear? Yeah, perfumes, deodorants, it is coming. Contact dermatitis, it is coming. Now it is clear, this point. Can we move forward the next case? A 13-year-old ready-made kashaya is good, so we have to prepare it. Yes. A 13-year-old normosonic male patient, reddish skin lesion with itching, present over pada for 1 month. Okay. So this is the case. What you are seeing in that lesion, what type of lesions? Crust, fissure, or like that, macule, papule, oozing. What you are seeing, please write. Please mention. Crust is there. Okay. Fissure, whether you are seeing fissure. Plaque is there. Okay, plaque is there. Oozing is there. Oozing is there or not? Crust and fissure is there. It is a dry lesion, isn't it? Dry crust fissure. Okay, no oozing is there. Okay, good, good, good. Reddish, can see reddish, pink, scaly, dry lesion with crust. Formation of fissures. Now everything you are knowing, I think. You are knowing all these things. Fissures, what is fissure? And on examination, bleeding present on cracking. No oozing. Okay. What is this diagnosis? What is this diagnosis? Eczema. Okay, good. What type of eczema? More Ayurvedic diagnosis? I am asking, okay, Vicharchika. You are knowing now, isn't it? And I am diagnosing it as Vicharchika Ruksha. Why? Next case is coming. We will go for Snigdha Vicharchika. What is the difference between Vicharchika Ruksha and Vicharchika Snigdha? Anyone? No oozing. Ajari is telling oozing. Ajari is telling oozing. That's the point. That's why I'm telling classics. Go for your classical books. Okay. Try. Okay. Rajya. Adi Kandvarti. Rujaha. So Ruksha Bhavandi Gatreshu Vicharchikayam. This is a slogan from Susura Samhita Kushtanidana. Rajya. Rajya means lines. Okay. You are knowing like crust. It is happening. Adi Kandu. Kandu is there. Okay. Adi Ruja. Kandu Adi Ruja. Severe pain is also there. It is Ruksha also. This is called Ruksha Vicharchika reference from Susruta Samhita. It is a Ruksha Vicharchika reference from Susruta Samhita. No Srava. Okay. And there are different types of eczema. Eczema it is coming after the case Lesicardia Vicharchika. Lesicardia Vicharchika is there. You have studied Lesicardia Vicharchika. That's why I'm telling about Ruksha Vicharchika. Your Lesicardia Vicharchika is coming in next case. It is Lesicardia Vicharchika is coming. Okay, please listen. That's why I am breaking the rules. You can question Charaga, you can question Susruta, you can question Vagbada, you can question Chakravani. Anyone you can question. You want to question them. Why? Because Acharya is accepting questions. Please check Susra Samhita, please check Charga Samhita, please check Vagbada. They are asking questions from the students, isn't it or not? All the texts are answers for the questions of the students. Yes or no? Yes or no? Yes, they are asking question. You can ask that question to me. I will give the answer. Then why are you not asking questions? You want to ask questions. You can challenge each and everyone. Science is challengeable. In the same way, Ayurveda is also challengeable. You can challenge it. But you want to have some stuff with you. That's all. You want to have something with you. Okay. This is Ruksha Vicharjika. I will tell the next case. It is a type of eczema, nomular eczema. I will tell eczema. It is coming. Okay, detailed eczema. Coin-shaped lesions on arms, legs. Okay, with itching, burning. Lesions are sometimes oozing, sometimes crusted. Reddish, pinkish, or brown, scaly, inflamed skin around the lesions. It is called this case. Okay, nomular eczema. So, what is the treatment option here? Yeah. Yeah, you can by treating. Okay, so I will tell in which way I have made. I'm writing whatever the teachers are writing to their patients. I'm making a book during my internship. I'm not a bright student during my UG, but during internship, I am writing whatever the doctors are about teachers are writing, and I'm making a stuff by my own. And whenever I am getting into medical office, suppose I am seeing at least 50 patients or at least 60 or 70 patients per day, so I'm getting a result of permutation combination, which one is effective, which one is not effective. In this way, you can make. It is to practice you can make, basically. That's why I'm telling I can give a stuff for you. You want to make your own protocol. Clear? But by the class, you can get an idea. That's all. So now you can see it is a pinkish, reddish, brownish lesion which is having crust, isn't it? So the options on your mind, Manjishtaji or Guluchadi, isn't it or not? It is not brackish. Okay, same. Vilvadi, Trabala Churna. You can go for wash also, no problem. But it is not an oozing type in eczema. Please listen. Don't go for wash in the early stages. It will sometimes make oozing sometimes. This problem you want to check. Okay. Clear or not? Sorset or burn cure ointment. Okay. So this is the treatment that I have given. I have gone for Manjishtari. But this is a patient of 13 years, I think. 13 years age. Isn't it? I'm also not 13 years. That's why this is the medicine that I have given. Manjishtadi Kasha, it is a bottled Kasha that I am giving. Okay, the patient is telling that he is coming from some distant place. It is not near, it is from distant place, and he is telling, I will take Kashaya, sir, no problem. But I am not able to prepare. So I am giving 5 ml kashaya, bottled kashaya, only 5 ml in 50 ml lukewarm water after food with tribala churna. Okay, tribala churna. Sourcet ointment I am giving. Why? Because no oozing was there. Vilvadi. This is the common option that I am going. But rather than Guluchadi, Manjishtadi is the best option here. Why? Because it is a typical Pitta Kaba lesion. Maximum and minimum quantity of which drug you are asking? Manjishtadi. Manjishtadi or not? This medicine you can Manjishtadi Kasha. I am giving like this. For basically for if it is a 5-year-old child, I will give 5 ml kashaya. If it is a 10-year-old child, I will give 10 ml kashaya. Bottled kashaya, I am telling for your use, it is rather than easy. For 1 year-old child, it is 1 ml kashaya. The quantity of water will be the same. Mixing water, it will be 60 or 50 ml. For 1 year old, it is 1 ml. 5-year-old, it is 5 ml. 10-year-old, it is 10 ml. 15-year-old, it is 15 ml. Up to 60-year-old, it is also 15 ml. I am giving only 15 ml kashayam with 50 or 60 ml lukewarm water for a bottled kashaya. Okay, this Orset ointment is working very well. That's why I'm not changing it. And second stage, okay, second stage we want a little bit change, isn't it or not? Second stage we want, I will show the photos. Okay, this is the thing. This texture was retained, isn't it or not? Yes or no? Texture was retained, isn't it or not? Please see the photo and tell whether this texture of the skin is retained. Yes, but something is left behind, isn't it or not? Isn't it or not? From this photo, something is left behind. Yes, clear? Here also, it is somewhat blackish. It is not completed. So I am changing it to Bond Cure ointment and Nalpamaradi Kera. This Kera cannot be applied in the first stage. Okay, why? Because sometimes it will cause oozing. There is no oozing. At least check for the second stage. Okay, I am applying only external application was there. I have stopped the Kasha in the second stage. I am just giving Bond Cure ointment and Nalpamaradi Kera for regaining the skin color. That's all. Clear? Clear? Any doubts? So first stage you can go for this, and you are stopping all the medicines directly bone cured and Nalpamaradi Kera. Muruvanda is also Kera base in which cases? Kera, basically Kera is the difference between Kera and Thaila. You are knowing Kera is coconut oil. I will tell Erodu. Okay, you can't now. I am in Chandigarh. I am now working in Chandigarh. Now winter is going on. Whether Kera can be used here? Whether Kera can be used here? Please, as a doctor, please mention yes or no. Why? Amandeep is here. He is from Chandigarh, I think. Why? Why? What is the answer? Why? Rukshatam. No Rukshatam. Environment factor. That's the answer. Why? Murivanda is also, we can't use Murivanda now directly. Murivanda is in low temperature solidify. Kera will solidify. We can't use. We are now using Thaila. For our purpose also, we are now using Thaila. Kera will solidify. It is coconut oil. It is having the solidification. You are knowing that melting point, boiling point, and all these things. Physics and chemistry matters everywhere. It's not Ayurveda all the time. Ayurveda is related with physics. That's why Padartha Vijnana. Okay, Padartha Vijnana is nothing other than matter physics in Ayurveda. Clear? I will tell. I will tell. So, importance of Rukshada in eczema. Anyone? What is the importance of Rukshada in eczema? Will not absorb in skin. No, we can't take it. If you want to take, you want to make melt it. Every day, if you want to melt it, how much time and how much money it will cost for the patient? You're getting Murivanda, you want to melt it in this temperature. That's the thing. Rudu is coming, I will tell. So, what is the importance of Rokshada in eczema with respect to this patient? Anyone? Vada getting increased. Only Vada getting increased. Okay, in Ashtanga it is mentioned as Sakandu, Pedaga, Shava, Lesikatya, Vicharchika. I think one student, one person is asking. Isn't it or not? It's not related. Ashtanga Hridaya is mentioned. So Kandu, Pidaga, Shava, it is oozing type of Vishachika. It is mentioned in Ashtanga Hridaya. But in Susruta, he is mentioning Rajya Adhika, the Ruksha type of Vicharjika, which is seen here. Clear? Dryness is an important factor in the manifestation of eczema and atopic dermatitis. Atopic, we will tell what is atopic dermatitis. Some eczema gets aggravated during excessive dryness, during winter, or during excessive dryness during Grishma, it is happening. And in next case, we can discuss together, then you can get an idea. A 64-year-old normosthenic male patient, skin lesions with itching and oozing present our pada for 1 month. All these are OPD cases. We can see the photo. Okay, clear. What is the diagnosis? Same side, same leg, but a difference is there. What is this? Increase itching. What is this case? Diagnosis. Now I'm telling you want to diagnose. Snigdha Vicharjika. Okay. I'm telling the answer, isn't it? Vicharjika. Sakandu Pedaga Shava Lesikatia Vicharjika. Okay. It is nothing other than Snigdha Vicharjika. Kandu is there. Pidiga is not a little bit there.